what is public health?
Public health is just that, promoting the health of the community.
Our primary focus is on illness prevention and health promotion.
We in fact have one of the first bachelors of science in public health in New York State. We're very proud of that.
It's one degree, but there are multiple career paths. We certainly have our traditional public health type careers, clinical health, healthcare administration. But our students also acquire a skill set that translates into other sorts of career fields: business and marketing, law and public policy, health informatics, nutrition, education prevention, sometimes with addiction and behavioral health.
The Addiction Studies minor provides students with all of the coursework that they need to become a credentialed prevention specialist.
Some want to do work with women and children. Some want to do work with immigrant populations.
There are a lot of people out there that have very different interests and they want to pursue them. Public health allows you to do that. You don't have to stick with just one specific sector. You can branch out to others.
The students that come to us are from diverse populations, and they will work in a diverse world.
Students are placed in agencies all over the community, the region, throughout the United States, and even internationally, to now put all that theory work to practice.
I taught English to older adults who recently immigrated over to the U.S.
At the American Red Cross, I work as an intern in the disaster cycle services.
It just so happened in my 300 level class that the VA was an option, and my family has a long history of being in the military. I met with the doctor twice a week. We traveled all across upstate New York to these veterans' homes. It's really just about putting yourself in their shoes in order to deliver the best possible care.
After they've completed an internship, most students will say, I had no idea it would be this great an impact.
A lot of the faculty are involved in cutting-edge research, and we're also involved in actionable research with the local community.
Even in my freshman year, I was involved in research within the public health department, and we did various epidemiological studies, so that was a really fantastic opportunity for me.
At the Lead Study, I'm an undergraduate research assistant, and the study itself is looking to correlate the idea of the lead levels in children in the Syracuse community and how that affects their cardiovascular health.
Some of our students are able to travel internationally and study malaria in Zambia, for example.
For my capstone, I get to work with Dr. Larson more on standardizing how they enumerate indoor residual spray, which is an intervention for malaria. I just love getting to have a hand in that while I'm just an undergrad.
This is what I say nowadays, public health is everything.
The community is the agenda. That's our reason for being there. But we also want to empower our community and educate our community to ensure that they're healthy.